So I am going to talk about the process of having a planned C-section and what that looks like, the consent, the surgical process, and everything that takes place. So some women, will have a planned cesarean for all different kinds of reasons. Maybe medical, maybe the baby's position is breech, maybe it was an emergency, whatever the case is. But specifically, we're going to talk about a planned cesarean because this is going to look differently than an emergency C-section would look. So once you arrive to the hospital and you check in, you're going to sign consent form saying that you give consent to having a planned cesarean section. Whenever you are done with that, you are immediately going to get in a gown and get on, probably a gurney or whatever, and your nurse is going to start an IV in your arm, which is placed on a board that extends out the side of the table. So this is once you're in the operating room. You are going to get an IV, and during this time, your blood pressure is going to be checked very frequently because they want to make sure you're doing all right. You might be offered a sedative for this time. You obviously can totally, deny that. You do not have to have that because you probably want to be aware of what's going on. At this point, once you're on the table, your anesthesiologist will administer the regional anesthetic. If you're having an emergency C-section, you will probably have general anesthesia because it's the quickest way to get the baby out. But for planned, you'll have regional, which means that you'll be awake and you'll know everything that's going on. Once this happens, you'll also receive oxygen with a face mask and nasal prongs throughout the surgery just to kind of help you through this time. You will also have a pulse oximeter that will be on your finger or toe to just track the oxygen in your blood throughout the surgical process. You will also get an electrocardiogram leads that are placed on your chest to help keep track of your heart through your surgery. They just want to make sure that you're doing okay, that you're handling the anesthesia okay, things like that. Then they will place a drape over you just like at the top of your abdomen. Some hospitals have clear drapes available where you can see everything that's going on, but a lot of times what I've seen is that they have windows in the drapes, so that way all you can really see is the baby coming out of the abdomen, which is like the moment your baby is born, and they're able to like bring the baby through the window, and you're able to do skin to skin in the OR. Whenever you're typically allowed to have one support person in the room with you, and that could be your partner or a doula, whoever you want to sit they'll be sitting by your head on a stool with you, just to be there for you, support you, and kind of share that moment with you. Your abdomen will be scrubbed and shaved, and then they will also place a catheter in your bladder so that way you're empty. And that won't be an issue as they're doing the process. So after all of these things are in place and your catheter is placed, then they will begin the surgery. So they will make the incision. Usually about 15 minutes after the surgery has started is when your baby is born. So it's very short, doesn't take a whole lot of time, and it's just a very quick process. And typically after your baby is born, most hospitals allow skin to skin in the OR room, assuming that everything's okay with your baby and everything looks good to go. So you'll immediately do skin to skin in the OR. This probably should be a question that you ask your medical provider beforehand, just to make sure that they do that, or you just want to know what's going on beforehand. So after that happens, the placenta will be removed, and then the repair starts, and that's the longest process. It'll probably take somewhere between 30 to 45 minutes because they have to repair everything, make sure everything's good to go. They want to make sure you're going to heal properly, and then at that point you're going to be taken to recovery. Your baby will stay with you the entire time, assuming that they don't need to go to the NICU or anything bad is happening. Your baby will stay with you the whole time. And once you're in recovery, you can try to breastfeed if you'd like, if you haven't tried that already. So it's just kind of like continuation of kind of like that golden hour. You can stay with your partner, the baby, maybe your partner will be able to hold the baby, things like that. So that is what it's like to have a planned C-section. And like I said, it looks differently for an emergency, but that is specifically for a planned.